Okay, well, good afternoon and welcome to the Advancing Women Leaders in Public Health panel, hosted by The Ohio State University College of Public Health Alumni Society. Established in 1984, the College of Public Health Alumni Society is one of the 50 plus academic and special interest alumni societies at OSU. We are proud to annually attain the highest level of achievement in Scarlet status. To accomplish this, we rely on our dedicated board members and our incredible alumni base to engage alumni, promote the public health profession, improve the student experience, and advance the university, the Alumni Society, and the college. As a reminder to all OSU College of Public Health graduates, you are always members of the CPH Alumni Society and there are no dues. If you enjoy today's event, I welcome you to attend others. And if you're interested in supporting us more and maybe joining our board, please reach out to our wonderful Alumni Relations Officer, Emily Zion, at zion, Z-I-O-N, .10@osu.edu, or you can check us out on the OSU CPH website. Before I introduce today's speakers or guests, on behalf of the CPH Alumni Society and the president, Sarah Newman, I want to thank everyone who helped bring this event to fruition, especially Emily Zion and Caitlin Hutchinson, and all of you for joining us this afternoon. And now to start with our event. March is Women's History Month, and I'm beyond excited to be moderating a conversation with 3 leaders. Each has found unique ways to pursue a career in public health and have found careers that are focused on building community and having a lasting impact. For today's agenda, first I'm going to invite each panelist to give a longer self-introduction to kind of share the context of their leadership journey. And then for the majority of the time, I hope we have a really good dialogue. And I welcome all of you to submit questions to the Q&A box. Sarah, our president, has agreed to monitor that to us, and we're incorporating your questions as the conversation moves forward. To kick off the introductions, my name is Naomi Adaniya. I'll be the moderator this afternoon. I'm the immediate past president of the CPH Alumni Society and the diversity chair. For my day job, I'm the chief data officer at the US Department of Justice, Drug Enforcement Administration. So as such, I have to say that all of my views this afternoon will be my own, and I'm not representing the department or any of its components. So to me, growing up as a first generation Latina, I was a voracious reader of female biographies. So for me, my childhood heroes were Eleanor Roosevelt, Madam C.J. Walker, Dolores Huerta, Nellie Bly, Barbara Jordan, just to name a few. What perhaps draws all of us here today is that there is something that links the lives and stories of these powerful women and our distinguished panelists. They're fearless, they have a strong perception of who they are, they're resourceful, wear many hats, they step up, they give back, and they lead. And they lead not only as women. If you had the opportunity to tune in this week to the Senate confirmation hearings for the Honorable Ketanji Brown Jackson, you would have heard Senator Cory Booker acknowledge that she is a person that is so much more than her race and her gender. And yet these identities matter. In his words to her, I know what it's taken for you to sit in that seat. So on that note, it's an absolute pleasure to allow each worthy panelist to introduce herself, starting with Waverly, followed by Jessica, and ending with Teresa. So Waverly, off to you.
Hi, my name is Waverly Gordon. I currently serve as Deputy Staff Director and General Counsel for the Energy and Commerce Committee in the House of Representatives. Similar to Naomi, I also give the disclaimer that I'm speaking on behalf of myself and not the committee or our current chairman. I graduated from OSU with a Master's of Health Administration in 2007 and decided while I was in the program that I actually wanted to pursue policy. So when I first entered the MHA program, I came with the interest of becoming a hospital administrator, as most students who go to OSU for our MHA program. During the first year, I took Professor Tannenbaum, who I think has since retired, class on Introduction to Health Policy. And I loved the class, and all my classmates hated the class. And I was like, this is like great, learning about the different things that go into making policy, the interest groups, the members, the staff, the constituents, or not staff, the constituents. And I was so excited by it, and the idea that you could sort of do things to affect, so many people at one time. And also while I was at OSU, I participated in the Council of Graduate Students, eventually becoming the president. And as part of that experience, we would come to DC or go to DC every year and meet with our representatives. So both Ohio senators, our home state representatives and senators. And that was sort of the first time I realized you actually could have a career working for members of Congress. Like I knew, members existed, but I never ever encountered anyone who had a career actually serving and working for members of Congress and helping advance their agendas. So from OSU, I attended law school. I went to Duke Law, and while there, I did a Duke and DC program, which allowed me to spend a semester on Capitol Hill in 2009, just as ACA was beginning to be debated. Just like, Obama, President Obama had just been inaugurated. I was in town for the inauguration. And so all the excitement about a new Congress, new presidency, and sort of that was sort of the discussion. Went back home, went back to school, graduated in 2010, came back to the Hill in September of 2010, 6 months after ACA passed into law. So I was here for all of the implementation, all the joys and the downsides of it, both seeing people get coverage as well as all the attacks against it. And in my journey up here, I started as a fellow through the Congressional Black Caucus Foundation, where I was with Congresswoman Donna Christensen from the Virgin Islands. She was a medical doctor and her specialty was health disparities. So I spent a whole year learning a lot about health disparities. From there, I went to the Committee on Education and Labor. Their focus in healthcare is the ERISA plan, so large employer plans, which cover approximately 140 to 150 million Americans. And then from that experience, I was hired to be senior policy advisor for Congresswoman Jan Schakowsky from Illinois. She is a person like myself who believes healthcare is a right. So much of my time with her was trying to find opportunities to advance her agenda on ensuring that everyone had access to healthcare, including that everyone was aware of the opportunities available under the new Affordable Care Act, which became the option to enroll in the marketplace plan that became available while I was working with her. From that experience, I moved over to the Committee on Energy and Commerce as the public health staffer. The committee has very broad jurisdiction. We had a former chairman who used to jokingly say that if you point to the globe, that's our jurisdiction. So we have anywhere from energy to environment to telecommunications to consumer protections and most of the domestic healthcare programs. And my role was to be over public health. So I advise on issues from NIH to public health preparedness to mental health and substance use. While I was here, while I was in that role, I worked on the 21st Century Cures Act, the Comprehensive Addiction and Recovery Act, the Support for Family Acts. And then after that, I actually came in more into a legal role with the committee, doing stuff around jurisdiction and process. And last year, I was promoted to Deputy Staff Director and General Counsel, which means I help oversee the entire committee's work. So that includes all our healthcare stuff, which is Medicare, BCD, Medicaid, CDC, NIH. It includes environmental health stuff related to EPA, as well as energy related topics. And so I get to see sort of healthcare as well as our domestic policy agenda from a pretty broad perspective. Okay, I would turn it back to you.
Well, good afternoon, everyone. And I would just like to thank the college for inviting me to serve on this panel. And I'm very, very just honored to be on this panel with Waverly and of course, Dr. Long. So I, of course, graduated from Ohio State in 2013 with my MHA and then my master's in public health in 2014. But prior to coming to OSU, I actually served as a core member in Teach for America. And I taught kindergarten, first grade, and fifth grade in Atlanta, Georgia. And it was really during that time where I struggled seeing my students just struggle with healthcare, access to healthcare. It really affected their ability to learn. And we know that if you don't have good education and you're not able to obtain and learn the information and opportunities needed, you're going to have a very difficult time in life. So that actually informed what I wanted to do with my career. And so at Ohio State, at OSU, I decided I wanted to pursue my MHA and become a senior leader at a community health center with a federally qualified health center. And I also wanted to get my master's in health administration or public health and health behavior health promotion, because I believe in holistic care, self-care, and care for the whole person and the community. So with that sort of as the foundation for my passion, while at OSU, I was able to work at OSU East with Elizabeth Seeley, who's one of my mentors, and I love her to death. Can't say enough great things about her. But I also had the opportunity to do my administrative residency at Emory Eye Clinic in Atlanta, and then also do my MPH practicum with ARC Ohio, which is now Equitas Health, which is an FQHC in Columbus, and they've grown since I was there. But while I was there at OSU, I also had a passion for diversity and inclusion. So I started the Multicultural Public Health Student Association, so MPHSA, and participated in NACI. And all of those experiences really shaped my career going forward. So from OSU, I was able to obtain an administrative fellowship in New Orleans at Ochsner Health System. And so I did the operations track and was actually recruited early out of my fellowship to become the clinic manager for the Center for Primary Care, Health and Wellness, as well as allergy. And I really enjoyed that work, but there actually became a time where the health system decided they were going to put a cap on Medicaid patients. And that shook me. That did not sit well with me because I care about vulnerable populations primarily and particularly communities of color. And New Orleans, of course, is primarily, a city with a lot of Black folks that need care. And they didn't want to care for them. And so I decided to make a change. And that's when I called on the OSU network and spoke with Dr. Pat Gabby, and she connected me with the Secretary of Health at the time, Dr. Rebecca Gee, and was recruited to take on a position with the Louisiana Department of Health, overseeing 64 public health units, which are actually called parish health units, providing safety net services to all of the constituents and citizens of Louisiana that need health care. But primarily it was those who were uninsured. I loved that role and got a lot of experience with emergency preparedness and hurricane response efforts, but then was actually recruited to take on a COO position, a Chief Operating Officer position with a FQHC in Lake Charles, Louisiana. So this was kind of like a dream job for me. I said, oh my gosh, I don't want to go to Lake Charles, but I do want to explore this opportunity. If you're familiar with Louisiana, Lake Charles is west of New Orleans, about 3 hours, and it's kind of rural. So it was a bit of a challenge to be there, but then we got hit by Hurricanes Laura and Delta, and Lake Charles was decimated. And I was kind of tired I had to lead through the recovery of two hurricanes, and decided I was going to evacuate or move to an urban area, and decided to move to Dallas. And so that's where I am now. And I'm currently the Chief Organizational Development Officer for a federally qualified health center here called Foremost Family Health Centers. And I also have my own LLC. So I'm a national board certified health and wellness coach. And so I've been running a boutique health coaching practice since 2018. So in addition to my daytime job, I also am an entrepreneur, and I'm helping people live their best lives. So that's me. So I'll pass it off to Dr. Long.
Hi, and good afternoon. And I'm mesmerized by the story. So how wonderful to be here. And with all of you who are here, I guess we're making history right now, which is super cool. And to hear about, well, I know Naomi and I know Waverly. Actually, I'm the lucky one. I know everyone on this group. So how lucky. So, and I can't wait to go back and take some more students to spend time with both Naomi and Waverly. That was fantastic. So there is no straight path, right? That's what I'm hearing. Nobody has a straight path. So my path isn't straight either to what I have done and what I am doing. But my journey, as Naomi asked for, is slightly different. I was born in San Francisco, born in California, and raised in the Bay Area there, as it's called, and was very excited about the ocean. And so my degree, my first degree was in marine biology at UC Berkeley. And that was an amazing place to be for lots of reasons. But it was actually as I was preparing for graduate school at the University of Washington, I spent a summer with them ahead of time. And it was great. They were out on an island in the ocean and the orcas were everywhere. But the director of the program pulled me aside along with the director of the Marine Station and said, we really want to talk to you. You know, we want you in our program, but two things. You smile too much to ever be taken seriously as a scientist. I do smile. And two, have you ever thought about, we really think you should think about getting something called an MD PhD. And that is actually something that would offer you a lot of flexibility. You'll be a woman. We don't know where you may end up, as opposed to having to be wed to the two coasts. Why don't you think about doing that? We think you might be able to be eligible, et cetera, et cetera. And I was stunned because I had been thinking one whole direction, and all of a sudden to have such a major change come upon me. And, you know, I quickly thought about it, and they were willing to fly me by seaplane and take me down to the university and get me going. Anyway, suffice it to say, it felt very sexist. It felt very ageist. There were lots of isms about it, and yet still trying to get my head around it. I decided to do that. So I did apply and applied across the country, but decided to stay in San Francisco and entered into that kind of a program. I found I loved medical school. And so anyway, as my journey went on and it unfolded over a number of years, I did have a chance to do a lot of things, but I decided to go into clinical medicine. And so started in pediatrics and had another huge journey why split in the road, and decided I really liked keeping people healthy and protecting health and well-being, and also about the context, about all of us and how we're all connected. And we all need to be helping each other be well, to be able to be the community, whatever that might be, the family, the community, the nation that we want to be. So I switched into public health and preventive medicine. I worked in San Francisco at the Department of Public Health for a preventive medicine residency right at the beginning of the HIV days in San Francisco. So that was amazing, but also worked on infant mortality, started the first school-based clinic there a long time ago. Jessica and I were just chatting about that. Suffice it to say, it was an amazing opportunity to do some advocacy and to do policy work, et cetera. So then what happened? Well, I got recruited to Columbus, Ohio. Never thought I would end up in a landlocked state, though we do have America's North Coast. I was recruited to become the medical director and the assistant health commissioner for the city of Columbus, the 17th largest city then. And honestly, I never thought I'd stay. I thought about some different opportunities along the way, but Columbus has been an amazing place to be, but also to be a woman professional. People were very welcoming, both in the medical community, the public health community, and the community in general. So I stayed 15 years doing what was a most amazing job, 15 and a half, and then had the opportunity to step up to become the director of health. So taking on all the HR, the executive, the finance, all of that responsibility. So I did that and then continued as the director of health for Columbus Public Health for another 16 years. So that was amazing. And then because of some accreditation opportunities, it just felt like at the right time to make a transition. I had, I think, a good succession plan in place if of course the mayor and our Board of Health would accept that. And they did, which was great. So I took a little bit of time off, and then I joined the university just about 3.5 years ago. And I work at the College of Public Health. I work part-time trying to make connections and support all different kinds of things for our faculty, for our staff, and for our students and our alumni. So reach out to me if there's something that you would like to get connected on. But primarily my role is around partnerships and community engagement. And it too has been amazing. I have learned so much since I've been here. So I look forward to more of our chat and obviously to questions and answers. But that's my journey.
So actually on that, Teresa, if you wanna, one of the first questions we ended up having is, so the College of Public Health, the Alumni Society has done a lot of work around first generation students. And so one of the questions we had is, what advice would you share with first generation college graduates who want to become leaders in their field?
Wow. Well, I think there's lots of need and lots of opportunity. And so I think when thinking about leadership roles, first of all, think about, do you want it? Because if you don't really want it, or there's something else you'd prefer to do, or a different aspect to it, then is the time you may be able to negotiate something different that you really want to do. So again, be mindful of what the opportunity is. But I also think that people who have degrees and our first generation students will have their, by definition, smart. They've had to work super hard to get where they are, that I think I would encourage them to, in taking on a leadership role, to listen well. Because both in medicine, you always know the patient will tell you the problem and usually tell you the answer. And I will tell you, I have found that to be the case, that our communities will tell us the problems and they will also tell us the answers, but we have to listen carefully and thoughtfully. But I also think then it is a responsibility both of the leader and actually I think a first generation student who becomes the leader has such an opportunity to speak and use their voice, because there is nothing like a personal story. And here we've started with our stories, but being able to be thoughtful, to speak up, the importance of good communication skills, I cannot emphasize that enough. To always be respectful and thoughtful, but again, to listen well, and then to speak up and use that voice. And there's lots of other aspects to leadership. Sometimes, I do listen well, but I also think it's important to speak up and sometimes think big and to think bold, and then be willing to, and again, this is in community settings and advocacy settings, to step back and be reasonable. Okay, so where can we get now? So what can I do with you and to gather others around, which again, first generation students and new leaders, there's I think people are super excited, both in the community, but around the university and in places of employment, in the work settings, to work together, to support, to listen in new ways, to hear those ideas. So it's a platform. So don't let go of it. So think big, think bold, but be reasonable as well. So I could go on, but those are some initial thoughts that I think of.
So Waverly or Jessica, do you have anything you want to add?
Yeah, I'll jump in. I would say take advantage to have conversations with as many people as possible. So while you're a student early in your career, like if you go to events where there's a speaker who says something interesting, or you meet an alum, like ask them to have coffee, ask them to have dinner, and share, ask them how they got to where they were, things for advice. I think oftentimes, as I can speak, like I was a first generation law student, I can speak for that. I didn't grow up around lawyers. So like even understanding the customs of law, the custom of success, what I should be doing when, if you didn't ask people, I would know, because I didn't have anyone that I could call on. And it really is just, trying to latch on to anyone you have access to. And it doesn't have to be, I think sometimes people are, so quick to be like, will you be my mentor? Which on this side is like, that's a huge ask. Because we're being pulled in a lot of different directions. But like I looked at it, and I still look at it as every time I get to have a conversation with someone that is higher than me, or I don't know, even if it's 30 minutes, like that is your time to extract as much information, advice from that person, to help you move on to the next level. Like if it grows from there, it grows from there. But like that is your moment. You got a 30-minute conversation with someone who has done amazing things because you want to talk to them. And so that would be my advice, is just really try to extract as much from the people around you about how they got where they got. But then also, as Dr. Long says, don't be afraid to take chances. Don't be afraid to try new things. And always believe that you are good enough to be wherever you are sitting.
So,
yeah. And just to add, yes, I do want to just add quickly too. I would just echo what Waverly stated. I know when I was going through the MHA program, I probably had about 75 informational meetings, literally just meeting with people. And I had like a set list of questions that I asked. And I would go and have tea or coffee, and I just wanted to soak up all the information. So I definitely would echo that. But then I would also encourage you all to develop a support network or a support system, a circle of folks that you can rely on and just kind of vent, because it becomes very stressful at times. And a lot of times we're not practicing self-care or self-compassion or loving kindness, and we're hard on ourselves, and that will wear on you. So this is my health coach hat coming on, putting that on. So I just want to also just encourage you to not be too hard on yourself and surround yourself with some folks who can support you through this journey, because it is a journey, and it will be hard at times, but just, keep pushing.
So you guys are stealing all of my questions, but if somebody wants to add to that. So I was just remarking that, women obviously I think are overwhelmingly carrying a bigger burden, right? As caregiving or even as care work, I think all of you, based on what you were saying, you oftentimes are the ones that raise your hand up, mentor, or helping navigate people, all those kinds of things. So besides what Jessica, and you can obviously add to it, what advice would you give essentially to just always kind of regulate and know that you're treating yourself well as well?
So just to add one other point to that, self-awareness is really key. So it takes time and it takes practice to kind of be able to recognize when your emotions might be a little off kilter, or recognizing and learning your triggers. But that's something that's going to be very key as a leader, especially a woman leader or woman professional. We're often judged by the way we react and how we manage our emotions. So I think that that's one really important aspect that as women in leadership, we must work through and manage.
I would just jump in there because Jessica, you are on it and you're a health coach. That's fantastic. This issue, and actually Waverly first started on networking. We all should have a network. And honestly, I didn't have mentors or sponsors or connectors. I just didn't. And it's unfortunate because I think that could be so valuable professionally, but also personally. And it may be a different group. I've heard of some women professionals who actually have a professional board of advisors, which that's super cool to think about, their own board of trustees. But also, as we go through life, and, we couldn't have had more upheaval than in the past 2 years. And we're not done yet, right? We are so not done yet. But this issue of resilience and how do we take care of ourselves and thinking about that. And I think both self-awareness is really smart, figuring out what it is that you can do for yourself, whether that's just a walk or standing at your desk and stretching, yawning, just even sometimes putting your feet flat on the floor and wiggling your toes is a resilience strategy. And having connections and figuring out, what it is that you uniquely contribute. That's part of a resilience strategy, because having meaning and purpose in our lives, both professionally but personally. And for some of us, it gets blended. I know that, but for some of us, it's not. And to also be aware of what you have control over, and being confident in that, and what you don't have control over, and how you can manage that. So, and again, recognizing what you're very competent in, because none of you would be here if you didn't have some really amazing competencies. So I would just, this whole notion of resiliency, and those are some of the things that I think about when I hear that. I just think it's so important, and today more than ever.
I think if I had anything to add, I think it's to the self-awareness point Jessica brought up. Like, there are trade-offs to every decision you make, both personally and professionally. And I think sort of the more aware you are, to Jessica's point, you will understand your trade-offs and understand what's acceptable and what's not acceptable. So there are certain people, like I was talking recently, it's a woman I went to undergrad with, who is like, her day job is being like general counsel for a housing authority. Then she has her own law firm. Then she has an event space. And I was like, she's doing amazing things. But I myself would never sign up for that. Like, I like I like having balance. Like, I like being able to like really relax and get away from things, like to have to leave work to go to work. And then to also have like events on the weekend, like it's not for me, but like she loves it. Like, you know, she speaks glowingly of the experience. It's a goal she's always had. And so I think like you really need to know like what are your goals and what are you willing to trade off for those goals, because like that, like her goals are admirable. And I'm like, man, like she really is doing a lot, but like, that's not my goal. I would be miserable. Like I would be complaining all the time about like, I didn't even have time to sit down. And like, I'm a huge sports fan and watch a basketball game, you know, like, so that's the thing to consider as well, is like, there are trade-offs to every choice we make.
So that feeds into one of our next questions. So this is an awesome question, so keep them coming. How did you assess and reassess your career situations to determine that you were in a position you wanted to be in, or decide that you want to reach in a different direction?
I'm happy to start with that because I've had that happen a couple of times. So I always kind of point back to my mission and what my calling is, what I feel my purpose is. And for me, that's really working with vulnerable populations and communities and making sure that I can help pave pathways for access to care for everybody. And so, you know, as I was mentioning the situation with Ochsner, you know, that did not resonate with me, that they were basically telling folks because of the type of insurance that they had that they could not receive care at their facility. And so for me, I had to make a very difficult choice to change organizations. And, you know, I had to really think about, okay, well, who am I going to contact, and start that whole process of having to network and have my, you know, 60-second pitch or my elevator speech ready to go. And I had to have a sense of, well, what do I want to do next? And that's all, you know, that can be very nerve-wracking, and it can cause a lot of anxiety about, okay, what am I doing next? But I let that inner just sort of spirit and purpose guide me, and just started to talk from my heart, and had conversations with various people in my network through Ohio State, and shared what I was interested in. And God is good. You know, I believe in God, and I'm a believer, and I have a lot of faith. And he opened up doors, and that, to the point of resilience that Dr. Long brought up, that helped me get through that. So I just wanted to kind of just share that with you. Think about your purpose, think about your calling, and kind of come back to that as you're evaluating positions and opportunities, because you can't go wrong if you're doing what you love. So
I think I would add how you know when it's time to make a change. What do you talk about when you talk about your job? Like, are you always complaining? Are there things that aggravate you? Like, if you're talking more about that, it's probably time to really sit down and think about, is it time to make a move? As far as taking advantage of opportunities, I would also add, be open to the possibilities, even if they don't fit your trajectory. So 3 years ago now, I guess 3.5 years ago, when I took on the role of being deputy chief counsel and doing more legal type work for the committee and jurisdictional work, it's not something I ever dreamed of, nothing I ever thought about. Like, I am a policy person. I dreamed of writing policy. I was in a good spot writing public health policy. And then it was like, well, you know, why not give it a try? You know, it was a promotion. It was learning something different. And then now that I sort of come back to the policy side, I still do the counsel side. Like, I'm a better person for it. Like, the conversations I can have, the strategies I can put together, I'm much better at it because I developed this skill and something that seemed unrelated to that if you'd asked me initially. And so I would say also be open to the possibilities, but make sure it's like fits your story. So I didn't just take the job and say, you know, it's a promotion, I got to go. It was like, okay, think about what skill am I going to learn? Who am I going to meet? Who am I going to interact with? What conversations is it going to put me in that I was not in before? And sort of thinking about your moves and stuff.
Well, I would jump in here because I'm kind of right in the middle with, I agree with everything that Waverly and Jessica just said. I also think that it becomes personal as well, as far as balancing. Is this going to be better for me as a person or not? And I would tell a story. It happened not too long after, well, a few years after I was here. I was asked and then interviewed for being the director of health for Seattle, King County. and was one of the final two candidates. And I was super excited about it, but the position actually had some awkwardness to it. So be careful when you think about new positions, really scope it out, because in that case, I would have been reporting both to a group of Republican county commissioners and a group of a Democratic mayor. So that sounds like a whipsaw if I ever heard one. But the other was, there was a new fella that I had met. And I thought, you know what? Why would I be, jumping one way when this, there might be some possibility. I wasn't sure at all. And actually externally, it kind of feels like today, it was right at the beginning of Desert Storm. And I'm like, my life, I don't think I need to take on something that I might get whipsawed. Why wouldn't I just check this out? This job that I have, I really love it. So why not stay? So, and the long story short is that all worked out for me. And the fellow who did take the job, who I happen to know, he got booted in about 14 months. So go figure, right? So I'm super happy with what I made that decision. But there's lots, and thinking about the personal side. And that's what I would encourage people to think, because there's lots of things in our lives. There's work, and how much work. And I think Waverly said it well. How much, are you willing to do and give? Because, people will take, your organization or your community will take. So if you have other interests, or, if, a family, I mean, we can talk about what it is to have a family and how to balance all that. Then you might make some other decisions.
So on that note, I don't know if Teresa, you want to keep going actually on that of how to juggle work-life balance, particularly with the family, because you did it very, very well yourself.
Well, I don't know. I would tell you, thank you. I don't know if anybody has any way of assessing how well any of us do in that. And honestly, work-life balance, it's not about getting a partner. It's not about having a family. It's really about how balanced we all feel. And, we can feel out of balance without those things, but other things. So again, I would say a couple things. So one is, so I did end up, getting a partner, and has been amazing. And we did have a child. So we, have a daughter. And I was extraordinarily lucky. I had been with a fellow for a long time before, and that did not work. It's actually partly why I came to Columbus. But so if you choose to seek out relationships that, you think you might, spend a lot of time with, choose well if you can, because there are a lot of relationships that I've been connected to that have not gone well. And that's really super hard. I would also say that it's always a balance. That word balance is right. And actually, I would throw in that it's also juggling. I mean, it is juggling sometimes as fast and creatively as you can. So being creative is good. So having a good partner works out well. Being flexible is super important when we take on kind of more family responsibilities. And I would say that we never know, right? Because women are caretakers and caregivers. And I couldn't have had a better partner than my husband, because he was amazing and is still amazing that way. But I watched lots of them that didn't have amazing partners, and the mom was still expected to do everything. Plus, she was taking care of older parents or somebody else's parents or siblings. So, or their own health became a challenge. So all of these things go into the balancing act and the juggling act. And honestly, I would say this is another place where both a professional network that can help, but really a personal network. And so think about that as you enter into these kinds of things where at least you have a choice. We don't have a choice if our family members get sick, really. But if you have some choice, who would I turn to if I need that? Are there parents around? Are there siblings around? Are there close neighbors or close friends that can act as my surrogate or any of our surrogates? Because you will need them. I guarantee that. And you will also need a workplace that is at least trying to be helpful. And if you get in a leadership role, I encourage you to be supportive of women, of moms, but of dads too. I mean, everybody is trying to juggle. So I would say, be flexible, both as the employer, but be flexible as the parent, as the mom, as the person who's trying to make this all work. Know that you will never be perfect, because you probably won't. I would also say you always have a chance, or at least almost always have a chance to get it right or to get it better. And so it will come back around. So again, think about your assets, think about your network. I couldn't have had a better opportunity with a key partner, and I loved having my daughter, and she was amazing. She became somebody I would talk about. And I'll tell you, being a parent gives you a lot to talk about, right? And it's very leveling as far as the experience. But I can tell you that there was a lot of fancy footwork, and also thinking through what was it that really mattered to me and what would really matter to my family. So just for instance, breastfeeding. Oh my God, I was a nut about breastfeeding. So most people wouldn't be, but I was a fanatic about it. So I breastfed my daughter for over 2 years, which people are shocked at. She never had formula. But that was me. I was just a nut about that. But it meant I was up super early in the morning and juggling and this and that and, whatever. So I encourage people to figure out what it is that's really important to them, what you're willing to be a nut about, and try and make that happen, but also to know that you won't probably be perfect. But none of us are perfect. So I would leave it at that.
So to kind of reframe it a little bit, maybe for Waverly and Jessica, is what do you guys both consider when taking on a leadership role, right? So I think Teresa already mentioned a little bit of like the juggling and personal life and whatever. What do you guys put into, I guess, the calculus?
Well, for me, I look at, the potential impact that I would have on the organization, on the community, and also, of course, the people that I'll be working with. So that's really important for me. And then also thinking about the actual people, my coworkers, what I'm going to be spending a lot of time with them, and I'll be pouring into them, but I want to also make sure that they'll be pouring into me as well. So that's really key. And then, of course, the work environment itself. So I, on a regular basis, assess, is this a healthy work environment? Are the employees and my coworkers happy? Are they ambassadors for the organization? Or are they, as Waverly mentioned, are they dissatisfied? Are they, venting on a regular basis? Are they feeling stressed? And so all of those things are really important when I consider an organization and a position. And then just to add quickly to the previous question about sort of balance, work-life balance, one, I would just say, take your PTO. If you can, take at least one day a month. So, and we think about those as sick days, but those should be wellness days where you are just unplugging from your work phone, from your email, so you can rejuvenate yourself and be refreshed. I know that I'm actually nearing my burnout right now because I'm working on this big project to open up our school-based health center, but I've already booked the cruise for the second week of April because I know it's time for me to step back and refill my cup. So I encourage you all to do that. And I also do that for my team as well. So they all have a lot of issues going on. Actually, one of my employees, her father was just diagnosed with stomach cancer, and she's been having a really tough time. So I really practice compassion and empathy with my team, because I know that if I'm showing that we care and that we can make accommodations, they're going to do work just that hard, that much more for us when we have different projects and things that we need them to do. So that's just something to really think about and be cognizant of when you are leading teams. And you need to be consistent, of course, right? So you can't do it for one and not do it for others, but just keep that in mind because folks are just going through a lot. And then lastly, I would just suggest that folks reassess the balance. So there's a wheel that I love, and this is again my health coach hat coming on, or putting that back on, but there's the 6 dimensions of wellness, and there's a little wheel that you can sort of rate each dimension of your life and various aspects of wellness on a scale from 1 to 10, and just rate 10 as this really, really balanced. Do I feel very satisfied in this area? Or 1, I'm not feeling satisfied at all. And then you just kind of connect the dots and see what's in balance and what's out of balance. And so I do that every couple of months to kind of see, okay, how am I feeling spiritually, or how am I feeling physically, or from a social standpoint and relationships? And that helps me kind of say, okay, Jessica, you're doing really well from an occupational standpoint, but spiritually you're struggling. So you need to get back in your word, or you need to reconnect to family members. So you can Google that. There's actually, I'm giving that to you guys for free, but you can Google that wheel out there. And I would advise people to just kind of use that if you're not really sure, if you're out of balance or in balance, and do that from time to time to kind of stay on track there. And I do have a dog as well. So I don't have any kids and I'm not married. So I have a little fur baby. Her name's Zoe. And so I play with her regularly, and that keeps me young. So that's all I would like to add.
I think what I would add onto that, because those are very much sort of my things as well, is I try to only do things that play to my strength. Like, I try to improve my weaknesses, but I try to do things that I really enjoy and that I do really well. Because if not, like, I will spend all my time trying to get better at it in my day, like in my job, versus like, using what I'm naturally, like my competitive advantage. Like, I try to go to my competitive advantage in any position. So that's one assessment I make, is like, is this something that I like doing, that I'm good at, that I think I'm better at than most people? Like, that's sort of one target area. I think the other thing is I'm very cautious of environments I work in. It's no secret what politics is today. I mean, like, you see it on TV, even though it's not quite as bad here to live it day to day. But like, it is a very, like, it's one of the few jobs that you actually come to that you are asked to fight for, like, the subjects you don't talk about in public, right? So, covering healthcare, abortion is a hot topic up here. Even being Republican and Democrat, or, like, you are always sort of pushed, and, like, you're fighting the other side. So like every day, like, you could truly be like ramped up because you're fighting for what you believe. Because that's why we all come in. We want to fight for what we believe in. And so I'm very cognizant of, like, are the people around me supportive? If I make a mistake, what is the consequences? Like, do you have the freedom to make a mistake? Because you're going to make them. I mean, like, no one is perfect. Will people give you the benefit of the doubt if you tried your best? Like, if something goes wrong, and not that you won't be held accountable for your mistakes, but it's more so, accountability, help you work through to improve your mistakes and get better at it next time, because they are going to happen. Also, ability to be yourself. So I don't want to go in an environment where, like, I am probably not, like, I sit on the board of introvert extrovert, and I live in an extroverted town. Like, everything here is about shaking hands, meeting people. Like, that, as I tell people, I don't get paid to do that. Like, that's not in my job description, because that's not something I enjoy. It's not something, like, I like meeting people, but it burns me out. And so I do think it's sort of, whatever I am, is it acceptable in my office? Like, whatever your quirks are. If you're loud, like, we have people who are very who can be loud and very emotional, and and that's accepted here. And then we have people who are very quiet and, like, cerebral, which is like me. That's accepted here. And so I try to find places that I would be comfortable, because we spend too much time at work to be somewhere that's uncomfortable. And there are far too many jobs in the world that you can make enough money to live how you want to live without sort of putting yourself into bad situations. Not that we don't land there, because we do. We land there, and hopefully we move quickly when we find ourselves there. But I'm very, particularly the higher up I'm going, I'm very cognizant of it, because there will be moments where, everything will crash down around you. And it's like, you want to be in an environment where people are there to support you in ways. Like, I remember I was an intern back in school, and a woman found out in the office that her mother had died. I think it was like, I want to say, and it was something like, maybe it was a car crash, like, it was something unexpected. And literally, like, I mean, she had a straight on panic attack, screaming top of her lungs. And, like, fortunately, like, the office was a community, because, like, I think I'm 20 at the time. And I'm like, this wow, it's a lot. But, like, people in the office came and talked to her, made sure to call her husband, made sure she got home safely. Like, you want to be in environments like that, particularly if you're going to be a leader, because you are putting yourself on the hook to care for people, to be criticized for your decisions. People are not going to be happy with you all the time. And you want to be somewhere that is going to be supportive of you in that moment.
So to follow
Have
up,
anything to- Oh, I'm sorry.
No, I was gonna say, Teresa, I was gonna go to you actually. So I was just thinking, again, kind of to extend on that same question. But I thought it was really interesting. You're the first female Columbus City Health Commissioner. So how much did you think about that and that you were breaking that glass ceiling as you were stepping into that role?
So let's hold on to that. I
Okay.
just think Jessica and Waverly gave amazing answers and just every little nuggets that just are so powerful for all of us as we think about, this or that. And actually Waverly just mentioned that, there's lots of jobs out there. I think there are. I was just with the Metropolitan Club yesterday, and the talent search, I mean, there is a fight for talent right now. So it's a great place to be looking around, but think carefully, think about the workplace, think about what you want. And I would say, just as they did about the leadership, and actually I got some nuggets from all of that as well. The only thing I would add is that when I've been asked to take on leadership roles, well, sometimes I don't have a choice. So that may be a difference. So, in some cases, in some workplaces, you might be able to choose, but in some cases, I wasn't able to choose. But best is if you can. And if it's not you, I always try and give 1, 2, or 3 suggestions about who would be great, because then the entity, the organization, your lead boss, whatever, is in a better place. And then the other thing that I have found to be successful is that if there's nobody who's better than you, and you still really are not that excited about it, but you probably have to do it, think about who could you bring along? Who could you bring along who would, be helpful? Who would it be a great leadership, learning lesson, opportunity? Who would be fun to work with that you haven't had a chance, and see if they might be willing, because it's a great way to make connections, to have somebody to bounce ideas off of. If you're going to get attacked, it's nicer to have 2 people as opposed to 1. Anyway, so and it's an opportunity. I mean, this is where the networking, and while I didn't feel, and we'll come to the glass ceiling, I never had a lot of network. And so this is a part potentially of building a network. And it's certainly a way of supporting women usually, but it could be women or men. We need a lot of male allies as well. So I'm certainly there, but thinking about who could really benefit from an opportunity, a leadership opportunity, and who would you really love to work with? So that's something I'd keep in mind. So what was it like to be the first female medical director and then the first female health commissioner? When I came to Columbus, it was a long time ago, and I immediately got involved both in medical issues. I mean, pick the groups that you want to be involved in that might help you in your career or help you in your personal life. So I got involved in some of the medical, it used to be called the Academy of Medicine, but medical society. And so got to know the physicians there very well, took on leadership roles. They were thrilled, and it worked for me. It was a great network that way professionally, but getting to know some other people, that was super good. But I remember walking into rooms, whether it would be in the mayor's office or over at the State House, but most especially, I remember walking into my first meeting of all of the health commissioners in Ohio. And there used to be 156 health departments, which some of you would be shocked at, but 156. And I would be the only woman. That was crazy. And so that felt odd. Now, there were nurses, there were nursing directors. So, I would talk to the health commissioners and I would talk to the nurses, but they kept pretty separate. And I can tell you that over my years, that has changed dramatically. I don't know if it's 50-50, but there are a lot of women involved, amazing leaders. There's a lot more diversity, people of color. It was all old white men when I arrived. And that's changed. And I actually think both public health is changing, both who's coming in as students, who's coming out as great potential colleagues and employees, et cetera. So this is good news. It's a good time to be there, I think. So it was weird. I mean, honestly, it was weird. And honestly, I also think something that probably played to me, I never really thought about being the first of anything or being a woman. I mean, I was Teresa. I was who I was. And I had a role and a job, and I was going to do it to the best of my ability. So I was going to, listen well, but step forward and step up, just like you've suggested, Naomi, and actually Jessica and Waverly. These are all things that people, in new roles, but in big roles and small roles, we all need to take. And it's not just about being a woman, it's about being who we are.
Yep. So I think networking is something that a lot of people had questions about. So one of the ones in the chat was, what things did you do to leverage your OSU network to advance your public health careers? And is there anything you would not recommend?
Okay, well, I'll jump in there. So in terms of things that I did to leverage my network at OSU is to stay in contact with people. So as I mentioned, when I was in the program, Elizabeth was my preceptor, I was GAA, and then I made it my business to meet everybody on the team there and actually meet with them on a regular basis. And I still stay in contact with many of them till this day. So Dr. Mary Howard, she's one of my mentors. Diane Gordon, who has since retired from OSU, is one of my mentors. Of course, Elizabeth Seeley, I consider her, and I know she's most certainly one of my mentors. And then folks from the program. So I really just make sure that I'm at least sending an email or texting or calling them or sending articles, or if there's something that I saw on the news, I'll just say, hey, I saw this on the news or LinkedIn. And so it's really just maintaining the relationship and connection in some way. Don't let that connection die, essentially. So you want to continue to just nurture those relationships in some way. Something as simple as when it's Elizabeth's birthday or Diane's birthday or Mary or whoever it is, I'll just shoot them a quick little, emoji message saying, hey, happy birthday. And they'll say, oh, I just appreciate that you remembered that. So something as simple as that will help keep those relationships alive. Of course, you should attend as many conferences as possible. Of course, that changed a bit with COVID and everything was virtual. But when you can get back to in-person conferences, I would strongly advise that you do so and attend all of the different events that the Alumni Society is putting on, that the college is hosting. I think those are great opportunities. And then just in terms of things that I would not recommend, is that once someone provides you the gift of their time, please at least send a thank you email. Please follow up. I've had some students recently, I spoke with them and they just never followed up. And I actually want to know, how did things work out for you? I'm just curious to know, like, hey, did this work out? So please don't reach out and then not follow up, because it doesn't, leave a good impression. And you never know when you might need to reach back out to that person and they'll remember that, oh, well, I helped you the last time and, I never heard back from you. So those would be my tips to all of you for networking.
So one thing I was going to add to interject is, I think, Teresa, with your comment at the beginning, when you said that somebody told you smiled too much, it's like, I remember when I first joined the department, they were like, well, you're going to have to, women are cutthroat. You're going to have to like cut your hair, dye it. And I think you can also give yourself permission to not have to take somebody as a mentor. Like, yourself. So you don't click for whatever reason, there's other people out there that are just going to be really supportive.
And to that point,
I love that idea. And choose your bosses or your colleagues as best you can. Choose them well, because they will make a big difference. And so when you're looking at jobs, you might say no because the work environment doesn't feel like it's going to be supportive. But I do think that the networking part totally makes sense. And keeping in touch, that I have not been as good about that from people from the schools that I attended. And actually, I feel bad because every once in a while I'll run into them and they're like, oh, wow, this is what you're doing, which doesn't feel very good. But again, I was never that engaged with them either. So.
And just one quick comment too. It's funny that, Dr. Long, you said you were told that you smile too much. When I was working in one of my earlier positions, I was told the same thing. I was told that I smiled too much and it seemed inauthentic, and that my authenticity as a leader was questioned. They said, oh, this was actually my supervisor when I was in my fellowship. And the person said, oh, you can't possibly be that happy. And I said, well, my last name is Jolly. I can't be happy. So I just echo everything you said about just trying to pick the right supervisor as best you can, because it can affect you. Let me say that.
And I just attended, and maybe many who are joining us did. There was just something from the women's place, which is part of the university, and they had a seminar on women, and I thought it could be, and it was quite interesting in a couple of ways. But one of the things that they said was that it's really not about us. We shouldn't have to fix ourselves. We should always be thinking, how can we fix the system? Because the system can be broken, and it can be broken for women especially. So it's something that actually I've always thought about. I don't know if I said it that well, but trying to figure out how could we in the workplace that I had a key role in, how could I make it more friendly, both for women, for men, for moms, for dads, for the community we were serving. Because, all of we'd always like to do more. And if we're not inviting or we're not engaging in those kinds of ways. And so, obviously telling someone they smile too much, sort of cuckoo, because people do like smiles. However, the one thing I would say, and I had to learn this, was you don't want to confuse people. So if you're giving someone a serious message, or you're actually quite concerned about something, a big smile is probably not appropriate. And so learning how to do that, I mean, and Waverly and Jessica both talked about how to learn things. These are things to learn. And actually, even in this women's place thing, they said, you don't have to take everything that your boss tells you. If you ask for a raise and they say no, well, don't go away smiling, say, or huh, or something, but be neutral. Say, can I think about that and get back to you? Because I might have some questions about how that is, or how I could learn from that, or be willing to follow back up. But you don't want to confuse the people you're talking to. So having a smile is appropriate many times, but not always. And that's probably true for a lot of our different kinds of, and, again, I think women are way better usually in emotional intelligence. We're often way better, softer communicators and learning and thinking about around the edges. But sometimes, and again, my smile and Jessica's, I wish I had a last name that was like Jolly, but those could stand to confuse people. So it's kind of something to think about.
I think I would add, think quality over quantity when networking. So, if you're going to sit down with someone, don't waste their time. Like, come with a topic you want to talk about. Like, don't expect to, like, some conversations I've had, people want to extract so much out of me. And I'm like, you asked for this. I didn't say I had questions. I had that, And so, be prepared. And, don't be something you're not. Like, in this town, I mean, in DC, there are world-class networkers. Like, there is a guy, who he's an alum of Duke Law, like, never forgets a name, never forgets conversations you had. Like, that is him. Like, he is exceptional at it. Like, maintaining conversations. I see him out somewhere. He asked me something we talked about 2 years ago. And, and it works well. Like, and he has found a job that is exceptional for. Like, I would never be good at that. Like, having to always introduce myself to people and try to build a relationship. Like, that's not me, but that doesn't mean I can't have quality conversations with the few people, so like now I try to say whenever I go to events, like, meet 1 or 2 new people and just have 1 or 2 conversations. Like, don't push yourself beyond that, just 1 or 2, and then go from there. And like, that works for me. And like, I think I get a lot out of it. I'm also not trying to make up stuff. And the people who I'm talking to, I feel like they're getting authentic me because I'm really engaged in whatever we're talking about. Versus just being like, hi, I'm Waverly, meet me today, stuff like that. So I would say that's the thing, is like, find what your style is and then maximize that style while you network.
So I think a really good question was put in the chat, and it's about advocating for yourself. So have you ever advocated for yourself in terms of receiving better pay or benefits? Have you ever felt you were being shortened in these areas because of your identity of being a woman?
I'll say yes. And my response, like when I found out about it, was to bring it up immediately and to talk about it. And it was a process, you know, like oftentimes we think like we notice something that we think is not right, and we, you know, you tell people and they're gonna immediately change it. It doesn't work. At least in my case, it ain't work that way. But it was like a process. It was like, you know, it was a continuing conversation that at different points I would keep raising that, like, I still have concerns about this. And at a certain point, you're at a, I feel like at some point in that experience, the thing I learned and what I tell people now is, you know, raise your concern. Like, you know, this is your life, your story, and you are providing value wherever you sit. And so if you don't think you're being valued, like, you need to tell somebody. But recognize there are consequences, right? So in some cases, like you raise your voice, like the consequences could be they want to get rid of you. Like that is a consequence. And others, you're going to get told no. And others, it's like, let's continue the conversation. And what the way I look at it from my experience having to deal with it is, you know, you say your story, they tell you their story. And at a certain point, either it's going to get better or not, but you get to make choices. Do you stay and try to work it out? Do you stay? Because sometimes it is, as Dr. Long said earlier, sometimes it's the system. And it's not even like the system, like, so at the it's no secret, the Hill right now is having in the House, there's a huge conversation about staff pay and the fact that a lot of people don't get paid very well, and then some people get paid below living wage. And, you know, some of that's systemic, like some of that is how much money is allocated and things like that. And so I think it's, you raise the question, but again, they're like, you have to sort of acknowledge the consequences, and you have to go in with a plan to say, if I raise this and they fire me, you need to have a plan of attack. Or maybe your answer is not say anything. Maybe your answer is start looking for jobs and networking, you know, in your field to try to line up other jobs. But I did say something. I think eventually, you know, it got better, but it was a long-term conversation to try to write something that I felt was inequitable. And again, at a certain point, I was left with a choice of do you stay or do you leave? And there's no right or wrong answer to that. It's just sort of, you know, what matters to you.
I've had the same thing happen. I mean, honestly, when I went from being medical director to being the health commissioner, there was no doubt there should have been an increase in pay. Anybody from the outside, and actually there were not physicians in health commissioner roles, but there were men who had similar experience as far as years of service in a couple of the other large departments, and who were getting paid 1.5 to almost 2 times as much as I was being paid. So I didn't ask for, you know, a huge increase, but I did ask for an increase. And the first answer was no. And the second answer was no. And finally, we agreed to a small raise. And then they actually made a promise that they never lived up to, which didn't feel very good either. But it was my choice. You know, it was my choice to stay. The job had meaning to me. So, I mean, I think these are the kinds of things that Waverly just said they happen. And do I think that there was a male female difference? Yes, I do. But I also think, and maybe, you know, maybe a fellow would have negotiated harder or walked away, but I wasn't willing to walk away. So, because I think that is the natural, and these are people you're going to have to work with, right? So you really do want to try and figure out, let's be fair, but let's also continue a working relationship. And we did manage to continue a good working relationship. I think it irked me for a while, and then, you know, on we go, right? Yes, it happens. So be careful how hard you fight or how willing you know where you're willing to go. And just as Waverly said, you may either need to walk away or you may get fired for it. But there's probably something else out there. I mean, I'm sure there was something else out there for me, but it might have been in a completely different town. And that would have been hard.
And then just to add, I see in the Q&A box that Jamie asked, have you been passed over for a leadership role because you're a woman or because of your lifestyle boundaries? And I'll just kind of add to the point about being passed over for a leadership role. I haven't necessarily had an opportunity or situation where I wasn't really paid what I felt I should be paid. I'm still relatively early in my career. So I think I like to say that, but I tend to pick in environments or organizations and supervisors who will pay me what I feel I'm worth. And so I've been fortunate to work for women who are willing to pay me what I feel I should be compensated. For the most part, I did have one instance where I was told that they couldn't pay me a certain amount. And then that information was actually publicly available when I was working for the state, and I could see, well, actually there was an opportunity to pay more. But it really wasn't a conversation at that time. I ended up having to decide, or I decided to move on anyway at that point in time once I found out the discrepancy. But in responding to the conversation or the question about being passed over for a leadership position, when I was at my last organization, some challenges occurred with the board and the previous CEO. And so the CEO was leaving, and so they were trying to locate an interim CEO. And so all of my team members said, oh, you got it in the shoe. They're most certainly going to select you to be the interim CEO. That did not happen. The board decided to bring in a man, a gentleman who really didn't have much operational experience, but had been in finance for many, many years at a health center. Very nice guy. I actually knew the person, but I was not considered for the position, although I led the organization through recovery efforts for 2 hurricanes and I did all this amazing work. And what was most disappointing was that the board was mostly women. It was a board comprised of women, and they even made the comment of, we don't believe that women are good leaders. And so that was very frustrating, to deal with from fellow women, right? You would think that they would be a little bit more open and forward thinking, but unfortunately that was not the case. And so for me, I also made a decision. I did make a decision to make a transition, because that really wasn't the type of culture I wanted to be in long term. If the board felt that women should not be in an executive position, I just didn't think that aligned with my values. So I have had that experience, and you just kind of work through it. I had to reflect on what were lessons learned from that. I actually did decide to, as Waverly mentioned, tell someone. So I actually filed a grievance with the EEOC, so Equal Opportunity, but you guys look that up. I can't remember. Waverly, what is the acronym?
Equal Employment Opportunity Commission.
Thank you for that. So I did file a grievance with that related to that particular institution and organization. And unfortunately, nothing came of it. However, I at least did share that because what occurred, I just really didn't feel it was appropriate. And we also found out that he was making, I think, 1.5 times more than the female CEO that had just left, and he really wasn't as qualified. So it happens, but we learn from it and we move forward. So just wanted to share.
And I want to share something, 2 things real quick. One, like, I do think we should get more into the practice of asking for a raise. Like, it's a muscle. Like, to be able to talk about money and ask for a raise, whether you get a yes or a no. Like, I think the more you ask, the better your muscle gets, and the more comfortable you become with the range of options. So, like, no, and it's like, okay, we're talking 6 months, or no, is what are other possibilities? Like, I think you just get, the more conversation you have about anything in life, I think you get better at it. So I think some of it is a muscle that we need to start doing just by right. And now that I'm on this side, like, there are people who definitely, like, year in reviews will ask for a raise, like every year, just in practice. And then I think the second thing, like, the other side of this coin, and it's sort of to Jessica's point, if you want something, you need to tell people. That's something I didn't realize initially. Like, I definitely subscribe to that hard work. Like, clearly I'm here working hard, I'm doing well. Like, of course you're going to consider me. Who else would you consider? Like, I'm good at what I'm doing. You tell me I'm good at what I'm doing. And it people will say, well, I didn't think you wanted it. I didn't even consider you. I didn't even realize it was something you were even interested in. And that's happened to me. And I definitely, it has changed how I sort of go forward in life. Like, if there's a position I want, like, I will pitch myself for the job, understanding you always get a no, but, like, I realized, and I saw a Stacey Abrams quote when she was out there saying she wanted to be vice president. And it's sort of faux pas for people to say that they're interested in being vice president. It's more like a whisper thing, and you get tapped on the shoulder. And she made a comment about for people like me, if I don't say I want it, they will assume I won't. I think that's very true. I think that's a very true statement. And that's sort of like, it was, I had already had my experience, but it was a reminder that yes, like you have to speak up, because people will say, she's happy doing that thing in the corner. Like she's great at it. It works well for me. I'm comfortable with her doing it. And will never be like, but doesn't she want to grow? Like, doesn't she want to do more? And so I think that's the reverse of this. But the other side of this coin, beyond just being passed over or not being paid, is you need to tell people you're interested, because it may not even cross their mind because they put you in a box and that's what they see you as.
So one piece of advice that I would say has helped me a lot, I think, is to just keep applying to jobs at least like every year, every 2 years, because then it keeps you sharp, and it also lets you kind of know what the market is willing to pay for you, right? So even if you don't take it, that's just like kind of feedback back. And that's, I think, helped me a little bit along the way, although it is very nerve-wracking to be applying to jobs all the time.
So Naomi, I think that's a really interesting practice. And so have you had a downside from doing that?
Not so much. So in the government, one thing that's helped is sometimes they let you apply to jobs as practice. So like I have to say, like DOJ has done a really good job nurturing kind of my career. And so now at this point, it's like, okay, I've knocked a couple of times, so then it just trains you. And so, yeah, so it's just, I thought it was pretty good.
I think that's actually a really good suggestion, to always kind of be paying attention to what's out there. And I think in some organizations that could be viewed in a negative way, because, if they hear your current employer hears that you're looking for other things, well, they're not happy here, they're going to leave. What does that mean, etc. But if it becomes just a part of who you are, and you could even tell people ahead of time, it's part of my, my practice. I don't know. But I think that's probably really smart. It's about exercising muscle, as Waverly said. Yeah.
All right. So I kind of wanted, you're winding down a little bit. So one of the questions I thought was kind of empowering is, so Condoleezza Rice has written that power is nothing unless you can turn it into influence. So I was wondering if you guys kind of knew a moment where you realized you had acquired or could exert power.
I would say it's the moment that people turn to you for an answer, and you look around and be like, man, who's supposed to be answering that question? And you realize it's you. I think that's when I realized, oh, this is a different world here. Like the expectations are, you're supposed to come up with a solution, and you're supposed to help guide the path. So I think that's one. I work in politics, so like, and another would be to try to get issues as part of the conversation. So one of the cool things about working in Congress and the diversity of the people who work here is there are conversations that will change just by who's sitting at the table. So when I first came to the committee, back when I was a fellow in 2010, the committee was not very diverse, like as membership. Like the Energy and Commerce Committee, I think there may have been a total of maybe 4 to 8 women, 2 to 3 minorities out of about 50 to 60 members. And so the conversation, maybe it probably was a few more women now that I think about it, but the conversation sort of like when my old boss would talk about health disparities, like she would be the person talking about health disparities. Like it wasn't a conversation that anyone else would raise. Whereas, and now like we're much more diverse, both racial, ethnically, gender, such that like the conversation about health disparities, you're not just having like one person talk about health disparities, you're having people talking about different communities and the experiences that they experience related to health disparities, be it the Black experience or the Latino experience or the Asian American experience. Even like we don't have any Native American members, but we have several members that represent huge populations of Native American and tribes. And so like the conversation you have just by virtue of who's sitting around the table also is a reminder of like the influence you can have because you bring your unique set of stories and experiences that other people just don't have. Like other people, I mean, like I'm not a mother, and I was having a conversation recently and someone brought up a question related to like children. It would have never crossed my mind. Wouldn't have been the last thing I ever thought about. I mean, like eventually I would have gotten to it and talking to people, but being a parent of a young child, like that's what you think about every day. And like that's what you bring to the table versus like me as a childless adult. Like there's other questions that I may bring to the table. And so like I think that's when I realized like it does, like you have influence just by who you are, but also in different positions you're in.
I would say that's a really interesting question to think about when you first realize that I am in a position of power. And I would say, I don't know when I probably first thought about that, but one time when I thought about it was when I was either in medical school or residency. People are asking you what to do, and they're also telling you their problems. I mean, it is amazing. And anyone who's worked in any kind of a clinical setting will know you hear the most amazing stories, and people are really seeking input, advice, direction. And it is a very, very powerful, special place to be. And so I remember that happening, some kind of silly things, moms wanted to know what to do about diaper rash. Well, we were in San Francisco, which is terribly foggy. And I used to tell them to take the diapers off the child and let them, crawl around in the grass. Well, that is ridiculous. No mother would ever do that. So I think about all the things I probably told people that were, I thought good ideas. They were not good ideas. But I think being mindful, it's an important question, because I do think, and it's not just about women, but I think in positions of power, to be thoughtful about what you're saying and to think about what the impact could have, and to know that it could well have differential impact. And Waverly was just talking about different groups and populations. It could be well. I am always mindful when I'm working in a community setting with lots of community groups that this might be an answer that would really be of interest or support of this group, but it might have a very serious or negative consequence. So thinking through and how to be inclusive and to use that power. I mean, I do think, and actually I think public health, by right of having, being well-trained, getting good skills, getting degrees, I mean, all of these women and you will all be in positions of power. And so being thoughtful about how you use that to basically lift up, what is it that you're about in that setting? But, for most of us, at least in a work setting, it's about how do we work together to create those conditions in which everyone can be safe or well, and all of us can be healthy or healthier.
This was a very interesting question for me, a hard one. Actually, I was sitting here thinking about what would I say, or what should I say? And so for me, I guess I think about it from an outcome standpoint and really the impact that I've had on other people's lives. And what immediately comes to mind for me is maybe just a couple of months back, my very first kindergarten class graduated from high school. And so one of my top students sent me a picture of herself in her prom dress, and then also her cap and gown. And she said, "Is this Miss Jolly? Is this your phone?" And I said, "Yes, this is still Miss Jolly." And she said, "You were the best teacher. You're my favorite teacher. I'll never forget what you did for me. You helped set a foundation." And so for me, like I teared up and I cried because I helped create a pathway for the kids that I was teaching in Atlanta. And that's what drives me. So that for me just was like, wow, I've been able to influence the lives of the next generation in some way. But then also just thinking about the ability to create and what will be sustainable. So I think back to when I was at OSU and creating the Multicultural Public Health Student Association. So thinking about MPHSA and creating other opportunities for those who are coming behind me, To me, that's the best opportunity, or what comes to mind when I think about influence and power, is how am I creating opportunities for others and having a positive impact. So, and then as a health coach, when people say, you know what, I lost 5 pounds, or I was able to pray 5 out of 7 days this week and my goal was only 2. For me, that's like the best feeling in the world. So I'm just grateful. I'm just so grateful that I can impact people in so many different ways. So, oh, I'm getting all emotional. I'm sorry. I'm self-aware.
No, so I think to wrap up tonight, which has been a great conversation, is maybe a quick round the horn of just the lessons. There's a lot of students, I think, that are listening. So maybe a lesson to your younger self, something that the new generation of public health graduates could take home. That'd be great. So I don't know who wants to start. I'm gonna pick on somebody if they don't. I'll go with Waverly. But you're on mute. But we went Socratic method, Waverly, just for you.
I look back at my time as a student, and this is a student in general. I very much I go to school, I do well in class and go home. I think if I could go back, and like I know my classmates, I would have taken the opportunity to try to get to know more of my professors and have more conversations about them, as well as like students that may have had an opportunity. Like, they're a huge resource. Like, they teach all the students to come through all the programs. That's any school. That was all, in all my degrees. They would have known the student that would have worked in a community health center, going to a hospital, or come to the Hill. And I look back and I've heard people talk about like the relationships they form with some of their professors and the conversations they have. And I was like, oh, I missed out on that. Whereas, in my professional life, like meeting people, networking, like once I sort of got into the world and was like, oh yeah, we need to start, I need to start meeting some people. So that's the thing I would say if I had once. And then my other thing, and I say this to all students, take advantage of student organizations to learn leadership skills, because it's very low risk, right? Like you're not being paid, you're not getting hired and fired. And it also, if you can convince people to do stuff for free, which is what student organizations are, you're trying to influence people to work towards some goal for free. Imagine how much those skills will transfer when it's actually you're paying, like when people are getting paid to do certain things. So I find them to be like laboratories to try new things, new leadership experiences. And so that's my number one goal, because that's like the stuff I learned in student organizations, I use every day in my day job.
And just to add to that, I echo everything Waverly stated, but just to try new things. So for example, with the case competition with some of the professional associations, it can be very time consuming, but it's a great opportunity to push yourself, try to, develop a business plan, network, have an opportunity to travel as well. So I would definitely just encourage you all to be involved and then push yourselves to try some of those case competitions as well. And then just be humble. I think that's just something so simple. And I had to learn that the hard way a couple of times, because I think I'm great, right? Everybody thinks you feel like you're really great, but you don't always have to verbalize that, or you need to be careful about how you verbalize that. So just be humble and practice humility, and then continue to maintain those relationships with your peers, because they will definitely come in handy over the years. And I stay in contact with the students who were in the class under me, and then also the folks in my cohort, and of course those beyond. And so that has been tremendous as an alumni of the program, and then just getting through the program, that was really, really helpful. So that's what I would share.
Those are really great suggestions. I would say, or add, because I think those are all really helpful, is to show up. And I think we've kind of heard that, to show up, to speak up. It's really when you try new things that you will learn something. And I think, and both Waverly and Jessica said it so well, you will learn things about yourself. You'll also learn things about others, which is super important, and about the world. So I think in that showing up and speaking up, you get a chance to use your voice. And you have a journey, just like the journeys that we've shared. And so, you know, it takes courage and bravery, especially to do things that you don't usually do, but you can do it. You can do it. And there will be lots more opportunity, but these are really opportunities. And there are other students who want to do the same thing. And there's faculty and staff who want to help you. And then there's this amazing alumni network, which is super cool. So again, I think I would say, try things out. This is an opportunity to fly. I have no doubt that you will. But again, to be thoughtful, to use your voice, and to show up and speak up.
Okay, so thank you everybody for joining this evening. I know we went a little bit over, and special thank you to Jessica, Teresa, Waverly, for being incredibly thoughtful panelists. I think everybody took home definitely at least 1 or 2 lessons to put in their toolbox. And then one of the things is they're asking me for the panelists, if you guys could smile so they could take a picture of us all at once. That would be great. Okay. Hopefully that was good. Okay. And yeah, so on behalf of the College of Public Health Alumni Society, thanks for joining, and hope all of you have a really great night.